Good morning everybody. This is Dr. Murli Bharadwaj. आज September 8th है. Another 14 weeks before we become the toppers in the NEET PG. So let us do a quick revision and next 15 minutes में I'm going to quickly revise for you around 100 hot points which are going to come in the tomorrow's exam. And today being Sunday, you all remember that every Sunday afternoon, 1 p.m. to 3 p.m. we will have a discussion of the full-scale NEET PG online mock test, live broadcasted. So please log in into YouTube and then enjoy a live broadcast interactive session. Now, pin index system. Why pin index system को इस्तेमाल करते हम? Because one cylinder cannot be fitted into the other's position. It is a safety mechanism, right? So the pins are so positioned that one cylinder with corresponding hole can only be fitted to the right cylinder. Now, what is the pin index? Favorite question. Oxygen 2.5. Purely, you have to mug it. Shamelessly, we have to mug it. One way to remember is oxygen होता है O2, so 2.5, nitrous oxide 3.5, cyclopropane 3.6, air is 1.5, nitrogen is 1.4. What is N10OX? 50% oxygen, 50% nitrous oxide. It is 7. Carbon dioxide more than 7.5% is 2.6. Carbon dioxide 7.5% is 1.6. That is what you need to remember. Now, what about halothane? Halothane एक गर्मागर्म anesthetic है, but it is a poor analgesic. Always remember, maximum analgesic होता है trilene. Profound मतलब deep analgesic होता है ketamine. And only analgesic, nothing else for the nitrous oxide. Nitrous oxide only is an analgesic, not an anesthetic, is what you have to basically remember. Page number 1, khatam. Also, analgesic, halothane also has got an analgesic action. Now, post-spinal headache. When will it start, doctor? Post-spinal headache in the first 3 days. And it will last for about 1 to 2 weeks. Many times this question was asked. And most painful IV injection होता है propofol. Propofol is called milk of amnesia. It looks like milk. Now, how is gag reflex maintained, doctor? 9th cranial nerve. All of you know this. Atracurium, renal failure, hepatic failure, कुछ भी हो, you can still use the atracurium because atracurium is metabolized by the Hoffman's degradation is what you should remember. Suxamethonium is metabolized by the pseudocholine esterase. All of you know very well. But one thing about suxamethonium से दिक्कत क्या है? Intracranial tension become increased with suxamethonium. Intraocular tension that is also increased with the suxamethonium, succinylcholine, एक ही है. Now, what is the most common nerve involved, doctor? Anterior dislocation of shoulder में axillary nerve, surgical neck of humerus में axillary nerve, shaft of the humerus में radial nerve, supracondylar humerus fracture में median nerve, Oakman's ischemic contracture में median nerve, and very important dislocation of lunate में. It is the median nerve is what you have to remember. Now, a few important bullets about brachytherapy. The type of the radiation in which the radioactive resources are basically placed. Based on that, you divide different methods of radiotherapy into brachytherapy, teletherapy, etc. So, if you take the interstitial radiotherapy needles, they are placed directly into prostate, into the penis and other soft tissue. Into other soft tissues, directly you will put the radiotherapy needles. Then इंट्रा-cavitary, inside the cavity लगा सकते. Urethra में what is the one which is kept? What is the radioactive iodine? Radioactive resource. It is cesium-137, and most commonly used for the temporary brachytherapy. Favorite question of the examiner. Which radioisotope? Like a quiz you should play with your classmates in the reading room. Iridium-192. Iridium-192 is the most commonly used for the temporary brachytherapy because it provides a higher dose of radiation. If you compare with I-125 or Palladium-103, etc., etc. So, Palladium-103 I-125 से भी preferred है. Iridium-192 is what you need to remember. Now, this Palladium and I-125 जो होता है, they are more often used as a permanent implant. Permanent implant. Now, you have to mug up, doctor. There is no other way. When बट्टी मारना है 4-5 friends के साथ बैठ के बट्टी मारना पड़ता. Radium-226 16-20 years. Cesium-137 30 years. Cobalt-65 5.3 years. Iridium-192 74.4 years expected life expectancy if you are born in India. Iodine-125 60 days. Phosphorus-32 14.3 days. Gold-198 2.7 days. Like a kirana store merchant, you have to mug up these things because these are the things which are asked in the tomorrow's entrance. One of them will come. Now, what are the commonly used agents for the IV induction, doctor? Intravenous induction. Thiopentone, propofol, ketamine, etomidate, midazolam, aldacin, and methotrexate. And already in my last video, I made a quick revision of important bullets about these various anesthetic agents. I hope you all have done the revision. IV anesthetic of choice of the day care surgery. Day care surgery होता है propofol. Sodium thiopentone, why it is such a ultra short acting agent, doctor? Not because of elimination, excretion, metabolism or whatever. It is because of a rapid redistribution. Rapidly it becomes redistributed. Because it is highly lipid soluble. It can go into the surrounding tissues. Dissociative anesthesia, ketamine. And why do you get post-spinal headache, doc? CSF leak. What is the concentration of the lidocaine? Examiner pakdega aapko. Spinal anesthesia mein. It is typically 0.5%. Lidocaine is used in different concentrations. If it is for, it is not 0.5, it is 5%, okay. 5% for spinal anesthesia. 4%, it is not 0.55. 4% topically in the eye. 0.5% in the epidural anesthesia. Epidural anesthesia is what you need to remember. अभी थोड़ा psychiatry का few unforgettable things which you don't want to remember but you have to remember, right? Now, attention deficit hyperactive disorder. What is the drug of choice, doctor? Methylphenidate. आप कभी भी मिथाइलफेनिडेट का टैबलेट भी नहीं देखते, इस्तेमाल भी नहीं करते, फिर भी एंट्रेंस के लिए बट्टी मारना पड़ता. There is no other option. Whether you are born in Assam or Uttar Pradesh, Andhra Pradesh, Telangana or anywhere, you have to read, you have to mug it, you have to remember, you have to reproduce. There is no other option. इसलिए मैं आपके साथ भी बैठ के, suppose if I say, students, you remember, बोल के बोल दिए तो मजा नहीं है, एक PowerPoint slide डाल के, आपके साथ बैठ के एक पेन लेके, this is called leading by example. That is very important, doctor. Tomorrow, you will be telling a lot to your colleagues in the hospital. Tomorrow, when you become postgraduate, house surgeons become your students, interns become your students. If you do the spinal tap and show them, you should lead by example. That is most important in order to make many more students to comply to the habit of learning, right? So every day you have to have your own 200 pages white notebook. Anyway, if you come into our WhatsApp study group, you will get all these papers which I am using for the handwritten classroom, right? Now, what is the drug of choice for delirium tremens? कोई अल्कोहल दारू पीने वाला सडनली दारू पीना बंद कर दिया, इसके वजह से सीजर्स हो रहा है. What will you use? Diazepam. Resistant cases of the schizophrenia. If you are unable to manage with conventional antipsychotics, clozapine is the one which is used. इधर टिक उधर टिक पूरा बदन में टिक. Gillis-Tourette syndrome. What is the drug of choice? Haloperidol. What is the drug of choice for the depression with suicidal thinking आ रहे, suicidal tendency? NEET PG क्यों करना? NEET PG करने के बाद क्या कैसा भी पेशेंट्स आके पिटाई करेगा हमको, क्या करेंगे? Electroconvulsive therapy, right? Now, what is the treatment of choice for the maniac depression, doctor? Maniac episode, lithium. Nocturnal enuresis, imipramine. Rapid cycling, bipolar disorder, sodium valproate. So you're not going to forget any of them because we are all studying together. We will all either remember together or we will all forget together. Forget तो हो ही नहीं सकता क्योंकि हम सब गर्मा गर्म रोज मिल रहे हैं, डिस्कशन कर रहे हैं. Least radio sensitive tissue in the body, which one, doctor? Nervous tissue. Least radio sensitive blood cell, platelet. Most radio sensitive blood cell, lymphocyte. Most radio resistant organ, vagina. Vagina, most radio resistant. How will you remember? Very common cancer is carcinoma cervix. Luckily, it is not vaginal cancer. Carcinoma cervix is sensitive to radiotherapy, but vagina is most resistant. Please remember. Most common organ to be affected by the radiation, skin, because it is continuously proliferating. Now comes the next by heart, hot by heart. Vertex occupying the left anterior quadrant of the pelvis is the commonest kind of a presentation, and it is called left occipito anterior. How will you remember? Aspiration prevent करने के लिए how will you make the patient lie down, doctor? Left lateral position, na? So the same position fetal will also lie down when it is inside the mama's womb. Now, what is the presentation? What is the diameter of engagement? खेलते revision करना. Vertex, suboccipitobregmatic, brow, verticomental, face, submentobregmatic, breech, biischial, shoulder, biacromial. You have to remember. Now, what is the most common presentation, doctor? Most common presentation, cephalic. Most common presenting part, vertex. Most common lie, longitudinal lie is what you should remember. अच्छा भैया, placenta previa, abruptio placentae. What are the differences? Which is painful, which is painless? Everything you should be good. Placenta previa. Previa कब बोलते हैं? When the placenta is implanted, partially or completely on the lower uterine segment. Lower uterine segment is not the place for the placenta implantation. अगर हो गया, then you call it as placenta previa is what you need to remember. So, how do you like to describe placenta previa, doctor? What are the features? Painless previa, painless previa, painless. Right? So, lower uterine segment में कौन बैठता है डॉक्टर? Normally fetus बैठता है. Fetus painful है क्या? नहीं है. अभी कौन बैठ रहा है? Placenta बैठ रहा है. So it is also painless, causeless. Why do you become pregnant? Causeless. I don't know how it happened that night. Now, recurrent bleeding, right? Then fresh bleed from placenta previa. Placenta is in the lower segment, it is low lying, and the uterus is soft and relaxed. Soft and relaxed. Now, how do you diagnose, doctor? You will do ultrasound and usually think placenta previa like a fetus. Fetal heart sounds are usually present in case of placenta previa. So it is painless, causeless, recurrent bleeding, fresh bleed. Fetal heart sounds are usually present. Ultrasound examination is considered to be the best way to localize the position of the placenta. Now comes, do you want to do PV? No, sir. Please don't do that, sir. Please don't do that, sir. Because if you try to do PV, already it is staying in the lower segment. So that is the reason it can precipitate a premature labor. And if at all you do PV, get ready, let the operation theatre room be ready. So PV should be performed in the OT room in placenta previa is what you should remember. Acha bhaiya, abruptio placentae, fatafat bolo. It is painful because already placenta previa is painless. Obviously this should be painful. Lot of times viva voce mein, if somebody asks a question, examiner पूछे तो भैया abruptio placenta painful क्यों है? Because sir, placenta previa is painless, sir. Can that be a reason why abruptio should be painful? Painful. It is a continuous bleeding. Continuous bleeding is definitely painful. Toxemia, already eclampsia of pregnancy is a painful condition. Even if it is not painful, you are giving max sulfate injections which are painful. So that is the reason. Remember, toxemia with abruptio placentae. Toxemia, max sulfate injections are painful. Abruptio placentae painful. Please don't forget. It is a concealed bleeding. बाहर जो दिखता है अंदर और ज़्यादा है. There is a sign of fetal distress. There is a shock. Preeclampsia is associated. The placenta is in the upper segment. Why in upper segment? Sorry, if it is in lower segment, we call it as previa. इसलिए upper segment, चलो upper segment. Uterus is tense. Why it is tense? Because placenta previa is not tense, it is relaxed. Okay. Then it is tender and light. Fetal heart sounds absent. And you have to diagnose it clinically. Now, not through ultrasound. Ultrasound is more useful for you with the placenta previa. ये तो पक्का clinical diagnosis है. Fetal heart sounds नहीं है, continuous bleeding है, pain है, toxemia है, इसलिए abruptio placenta है. Right? Now, how do you treat? Correct the shock, most important. The mother should be alive, first priority. Right? First priority, mother should be alive, hypovolemic shock. Give dexamethasone and deliver the baby by induction. There is no role for a dead baby to be delivered by cesarean. So that is the most important. Suppose if the baby is alive, then deliver the baby by induction is considered to be the important indication. Always only when you remove the fetus, eclampsia will resolve. Now, doctor, growth retardation, short stature. This is the most favorite topic of the NEET PG, doctor. Mark my word. NEET PG examiner, मैं अब भी पेपर लीक कर रहा हूं आपके लिए. Definitely पूछने वाला guarantee question है doctor, guarantee question है. Right? Now, when bone age means epiphyseal development, is less than chronological age. Chronological age is आपके progress report में रहता ना, Ramu is studying 3rd class and according to the date of birth, his age is, that is chronological age. When the bone age is less than the chronological age, Ramu 5th class में है, मगर bone age 3rd class का है, इसको कहते हैं delayed bone age. What are the causes of the delayed bone age? Is the favorite question of the examiner. If it is markedly delayed, think of hypothyroidism, hypopituitarism. ग्लैंड के ऊपर बदनामी छोड़ दो. Moderately delayed malnutrition, अम्मी जान खाना नहीं खिला रही. Chronic infection, if it is only a mild delay, no problem, constitutional delay. Ramu's daddy, Ramu's grandpa, Ramu's great-grandpa, everyone were shot when they were in 5th class. That is constitutional delay, which is a mild delay, is what you have to remember. So, delayed bone age, what are the causes? You'll remember me now? Definitely, आप एग्जाम लिखते वक्त हंसते हंसते लिखेगा, अरे भाई उस दिन डॉक्टर मुरली भारद्वाज ने बताया, हाँ एग्जामिनर पूछा. सो वो हंसते हंसते लिखना है आप एग्जाम को. देन ओनली यू आर डॉक्टर मुरली भारद्वाज स्टूडेंट्स. नाउ डॉक्टर बोन एज इज एडवांस्ड, वो आगे बढ़ गया. 5th क्लास के रामू को 8th क्लास का ऑसिफिकेशन सेंटर्स अपीयर होना शुरू हो गया. When will it happen? If there is a familial short stature, this is important. Constitutional delay means late bloomers. आज वो छोटू दिख रहा है. By the time he go to 9th class or 10th class, suddenly he will become tall. That is different. Constitutional delay is late bloomers. First few people, familial short stature will be there. In these people, the bone age is in advance of the height age. Down syndrome, Turner syndrome, मतलब chromosomes जहाँ involve होता है ना डॉक्टर, chromosomes, they will typically make you short by making bone age advance of the height age. Chondrodystrophies, intrauterine infections. Focus आ जाना भाई. Focus is important डॉक्टर. जिंदगी में focus रहना. कैमरा हो या नीट पीजी प्रिपरेशन हो, फोकस रहना. लिमिटेड मटेरियल पढ़ना, जो एग्जामिनर पूछेगा वही पढ़ना, वो फर्स्ट प्रेफरेंस में पढ़ना, क्योंकि टाइम वेरी लिमिटेड है डॉक्टर, वेरी लिमिटेड. टाइम इज शॉर्ट, आर्ट इज लॉन्ग एंड द अपॉर्चुनिटीज आर फ्लीटिंग. प्रोक्रेस्टिनेशन इज किलिंग द टाइम. दैट शुड नॉट हैपन, राइट? सो स्टोरेज डिसऑर्डर्स, बोन एज इज इन एडवांस ऑफ द हाइट एज. एक बात याद रखो यारों, पैदा होने के बाद क्रॉनिक इंफेक्शंस के वजह से बोन एज विल बी लेस देन द क्रोनोलॉजिकल एज. मगर पैदा होने के पहले इंट्रायूट्राइन इंफेक्शंस के वजह से बोन एज बिकम एडवांस ऑफ द हाइट एज. टॉर्च ग्रुप ऑफ इंफेक्शंस एक्सेट्रा, बोन एज इज एडवांस ऑफ द हाइट एज. क्रोमोसोम्स की वजह से बोन एज बिकम एडवांस ऑफ द हाइट एज. दैट्स व्हाट यू हैव टू रिमेंबर. Then we are talking about height age, not chronological age, height age. Then bone age is in advance of the chronological age. Chronological, this is the place where 5th class Ramu को 8th class का 5th class पढ़ने वाले रामू को 8th class भीमू का ossification centers दिखाएगा. Whereas bone age is in advance of height age means, according to his height, this guy looks like 5th class boy. But ossification centers जो है 8th class का दिख रहा है. So that is called bone age is in advance of height age. Then bone age is in advance of chronological age. What are the causes? This is a favorite question. Precocious puberty, thyrotoxicosis. In these situations, bone age is in advance of chronological age. फटाफट बोलो डॉक्टर. Delayed bone age means bone age less than chronological age. Hypothyroidism, hypopituitarism, moderately delayed in malnutrition, chronic infection, constitutional delay. Suppose if the bone age is in advance of chronological age, precocious puberty and thyrotoxicosis. Bone age is in advance of height age means you will think familial short stature, Down syndrome, Turner syndrome, chondrodystrophy, intrauterine infection, storage disorders. This is what you have to remember. So, ये sheet हर एक बुक में मिलता है डॉक्टर. All coaching entrance books में, all coaching entrance books, any coaching entrance book is good nowadays very detailed, सब लोग रामायण लिख रहा है, सो टेंशन वहां कुछ भी नहीं है, टेक्स्ट बुक में भी अवेलेबल है. फिर भी आप व्हाट्सएप ग्रुप में ज्वाइन हो जाओ. A quick commercial, 953 high yield topics in NEET PG, 600 hours, I say video discussions on 953 high yield topics in 600 hours we have done, and we have put it on online mbbs.com video library. So आराम से next 4 months में आप 600 hours of your time invest करो. Call 900868 join the online mbbs.com video library and join our WhatsApp study group. Now doctor, the next favorite topic, vitamin D. इसका required daily allowance पढ़ना पड़ेगा. मैं पढ़ूंगा इतने चीजें, oh my god. फिर भी we have to. Adult 2.5 micrograms, 100 international units. Infants and children 5 micrograms, 200 international units. Easy to remember, उतना मुश्किल तो नहीं है. 10 micrograms pregnancy lactation, 400 international units. 1 international unit of vitamin D is 0.025 milligrams of calciferol. For the management of the rickets, how much will you give, doctor? 15,000 milligrams or 6 lakh international units. 6 lakh international units of vitamin D3 orally or IM will induce rapid healing is what you have to remember. अभी आ गया bald head के बारे में ठकलू discussion आ गया. Now let us become experts in this ठकलू matters, right doctor? So what is our aim? We should become NEET PG toppers before we become bald, right? It's a good slogan, right? Now, scarring alopecia, non-scarring alopecia. So, scarring यानी cicatrical scar alopecia का causes क्या है? L for lichen planus, L for leprosy, L for lupus vulgaris, L for lineoscleroderma, sarcoid, syphilitic gumma, cutaneous metastasis, favus, carrion, traumatic alopecia. मतलब कोई आपका गर्लफ्रेंड आपका हेयर पकड़ के खींच रहा है, रीडिंग रूम से बाहर निकलो, मेरे साथ मूवी चलो, traumatic alopecia. Then injury, burns, herpes zoster, pseudopelade. These are all the reasons. L for love. Love में होता है cicatrical alopecia. Now doctor, you also have DLE, discoid lupus, dermatomyositis, herpes zoster, pseudopelade. All these things lead to cicatrical scarring. अच्छा भैया, नॉन सिकैट्रिकल कहाँ होता है? टिलोजन एफ्लूवियम, एनेजन एफ्लूवियम. डिलीवरी हुआ, पोस्टपार्टम देयर इज अ लिटिल स्ट्रेस एंड हेयर के ग्रोथ साइकिल गड़बड़ हो जाएगा. दैट इज नॉन सिकैट्रिकल, नॉन स्कारिंग एलोपेसिया, रिवर्सिबल. मेटाबॉलिक डिसऑर्डर्स, नॉन सिकैट्रिकल एलोपेसिया. ट्रिकोटिलोमेनिया, आपको ऑब्सेशन है, एक नीट पीजी एमसीक्यू का आंसर नहीं आ रहा है, immediately you are plucking your hair, that is trichotillomania, is non-cicatrical. Alopecia areata, autoimmune condition, that is also non-cicatrical. But one point you need to remember, doctor, one more thing, few more things for non-cicatrical. Androgenic alopecia, non-cicatrical. SLE, non-cicatrical. अब भी आ गया. एग्जामिनर का ट्रिकी क्वेश्चन बताऊं क्या? Secret, don't tell anybody, only you should know this, right? DLE causes scarring alopecia, SLE causes non-scarring alopecia. कल के एग्जामिनर आपको पकड़ेगा, मुझे तुझे मालूम है क्या? अब बोलना, क्या बोलते? डॉक्टर मुरली भरद्वाज का स्टूडेंट है भाई, हम क्या सोच रहे, हमको मालूम नहीं है क्या? तो एलोपेसिया पूछ रहे हैं, बोले तो आई वॉज एक्सपेक्टिंग इट, आई एम एक्सपेक्टिंग इट. In that also, I am well equipped, armed with scarring versus non-scarring. In that also, I know the tricky point. मेरे भाई, DLE होता है scarring, SLE होता है non-scarring. That is what you have to remember. Yes is not yes. S is not S. S is not S. S is non-S. Is not S. Non-scarring alopecia बेटे. Now, फटाफट बोलो. STD के बारे में हम स्टडी करेंगे STD के बारे में. Donovanosis granuloma inguinale. What is it caused by? Calymetobacterium granulomatosis. Typically, it will be a red granulation, garma-garam, bleeding tissue, right? But it is painless. Donovanosis, painless. Granuloma inguinale, painless. Chancroid, painful. Chancre of syphilis, painless, right? So, syphilitic chancre, painless. Chancroid, painful. Fir Donovanosis, painless. Oh my God. You have to remember. It is an indurated ulcer, just like syphilis. But syphilis is painless. Donovanosis also painless, very good. Whereas chancroid is soft, it is not hard. Now, what does it involve, doctor? Most commonly genitalia, inguinal and anal. Pseudobubo. Where do you see pseudobubo? Donovanosis. Genital swelling, especially labia. Pseudoelephantiasis is seen. Then how do you diagnose, doctor? Donovani bodies and safety pin appearance. You should not forget safety pin appearance, right? So this is the safety pin appearance. Donovani bodies. How do you treat Donovaniosis? D for Donovani, D for doxy. So doxycycline, tetracycline, Donovaniosis. You should not forget. Other pregnant women have Donovaniosis. Erythromycin are the ones which are considered to be the treatment. Favorite question of the examiner. Bhaiya, khujli lag raha hai. Between the fingers, I am feeling itchy. What kind of patient do you have? Scabies, Sarcoptes scabies. It is more common in winter. Incubation period is 3 to 6 weeks. Scabies. Now, doctor, what is very important? रात में आज की रात एक ऐसी रात मुझे बहुत खुजली लग रहा है क्यों है ये ऐसा क्यों किसके बिस. That is what you need to remember, right? Nocturnal itching, entire family में itching, night होते ही itching, that is scabies baba. Burrow is the characteristic lesion. That is a tunnel made by the female mite. Into which layer, doctor? Stratum corneum. And it is a S-shaped burrow in the stratum corneum is what you need to remember. What are the other lesions of the scabies, doctor? Papules, vesicles, excoriations, crusted lesions, etc. etc. It is the interdigital space, anterior wrist होता है ना doctor, anterior wrist वहाँ होता है, and ulnar border of the hand, that is the place where you have scabies. And in the adults, it can happen on the scalp, the face, the palms, the soles. These are characteristically spared. Scalp, face, palm, soles in the adults characteristically spared. That means किस में होता है? Infants में scabies can involve penis, palm, sole, scalp, face, neck is what you have to basically remember. So these are the points. Nodular scabies, कब बोलते? It involves scrotum. Nodular scabies involves scrotum. So what is the treatment of choice, doctor? Permethrin, first choice. BHC, second choice. And ivermectin is the only oral drug for the scabies. You have other drugs, benzyl benzoate 25%, crotamidone 10%. And scabicides you need to apply whole body. Just because hand ko nahi. Below jaw line in the case of the adults. And not only whole body, all members of the family, whether symptomatic or not, पूरा परिवार की संक्षेम पदक, परिवार संक्षेम, प्राइम मिनिस्टर परिवार संक्षेम स्कीम में ले जाना है पूरा स्केबिस के फैमिली को, बराबर। नाउ डॉक्टर, नॉन डिपोलराइजिंग ब्लॉकर्स, what are the drugs, what are the conditions that precipitate and potentiate the non depolarizing blockade? Favorite question of the examiner. Quinidine, it potentiates. Similarly, prolongation of the neuromuscular blockade, hypothermia, hypocalcemia, not hyper, hypocalcemia, hypokalemia, acidosis, but hypermagnesemia, and quinidine and procainamide. You should remember the factors that prolong the neuromuscular blockade. अभी जरा oncologist बन जाएंगे कुछ minutes के लिए. So when you go to the reading room, doctor, you should think that this is the funny part of the NEET PG preparation. There is nothing to cry about it. Everyone has to do it. There is no shortcut, and certain basic minimums. There is a list of around 5,000 items like this. I'm going to completely give you an opportunity to sit along with you and do the revision of 5,000 matters, which are the बट्टी मारने वाला matters होता है. अकेले बैठ के पढ़ाई करे तो बोर लगता है, ठीक है. नाउ रेडियो सेंसिटिविटी, हाईली सेंसिटिव ट्यूमर्स. रेडियो सेंसिटिव क्या होता है? सेमिनोमा, विल्स ट्यूमर, माइलोमा, लिम्फोमा, इविंग सार्कोमा, highly sensitive. You remember, right? Ewing sarcoma, lymphoma, myeloma, Wilms tumor, seminoma, they're all highly sensitive. Then what are moderately sensitive? Small cell lung cancer and breast cancer. Similarly, basal cell carcinoma, medulloblastoma, teratoma, ovarian cancer. These are all moderately sensitive. Then relatively resistant क्या होता है? Squamous cell carcinoma of the lung, hypernephroma, rectal carcinoma of the bladder, soft tissue sarcoma, cervical cancer, relatively resistant, doctor. So we give radiotherapy for cervical cancer. It is a relatively resistant one. In spite of that, we give the radiotherapy. Melanoma, osteosarcoma. I will not listen to you. Radiotherapy, I will not listen to you. Melanoma, osteosarcoma. Melanoma, osteosarcoma. मगर ये इविंग सार्कोमा देखो कितना सेंसिटिव है रेडियोथेरेपी से. अरे ऑस्टियोसार्कोमा, उसको इविंग सार्कोमा को देख के जरा शर्मिंदा होने की बात है. देखो वो कितना अच्छा है, वो तो हाईली सेंसिटिव है. तुम भी हो, completely radio resistant हो. That is what you have to remember. And even pancreatic carcinoma also, pancreatic carcinoma, highly radio resistant. ये तो हम एक्सेप्ट कर सकते. थोड़ा ये रेट्रोपेरिटोनियल स्ट्रक्चर है, बहुत पीछे है. हड्डियों में ऑस्टियोसार्कोमा क्यों रेडियो रेसिस्टेंट रहना? टू मच है ना डॉक्टर. राइट. नाउ डॉक्टर, शिजोफ्रेनिया, जरा साइकोटिक बनेंगे थोड़ी देर के लिए. Schizophrenia में favorite question of the examiner, doctor, Schneider's first rank symptoms you have to be very very sure about. Hallucinations, audible thoughts, voices heard arguing, इसको सीट मिलेगा, नहीं इसको नहीं मिलेगा. Voices commenting on one's action. देखो गीता पढ़ रही है 4th bench में बैठ के, गीता पढ़ रही है, अरे कितना सुंदर लिख रही है. Voice commenting on one's actions. Delusional perception, thought alienation, thought withdrawal, thought insertion, thought diffusion, passivity phenomena. Oh my God. Made feelings, affect, made impulses. These are all considered to be the Schneider's first rank symptoms, doctor. बट्टी मारो, मगर भूलना मत, एग्जामिनर डेफिनेटली पूछने वाला क्वेश्चन है. ब्लूलर साहब ने 4 A's लाया, इसको 4 A's ऑफ ब्लूलर बोलते हैं शिजोफ्रेनिया में. सो व्हाट इज द इंपॉर्टेंस ऑफ ब्लूलर? यूजिन ब्लूलर पागलपन को शिजोफ्रेनिया बोल के एक अच्छा नाम दिया, राइट. हमको भी क्या मिलता, MD मिलेगा, उसके बाद DM कार्डियोलॉजी मिलेगा, DM न्यूरोलॉजी मिलेगा. यू थिंक दे आर ऑल ब्यूटीफुल टर्म्स? नो नो, वो पागलपन का स्पेशल नाम है. ठीक है. नाउ एम्बिवलेंस किसके लिए हम प्रिपेयर हो रहे? पागल खाने को जाने के लिए, राइट? हाँ. एम्बिवलेंस कंफ्यूजन. ऑटिज्म विड्रॉल इनटू वन सेल्फ, एक रूम में बैठ के डोर्स क्लोज करके लाइट ऑफ करके पिल्लो के अंदर हेड लगा के मुझे मिलेगा क्या, नीट पीजी में सीट मिलेगा क्या, मैं क्यों पढ़ाई नहीं किया पूरा 4.5 years को. दैट इज ऑटिज्म विड्रॉल इनटू सेल्फ. अफेक्ट, मूड अच्छा नहीं है यार. एसोसिएशन डिस्टर्बेंस, these 4 A's are called blulers. 4 A's is what you need to remember. Similarly, made volition or acts of somatic passivity, they are also the Schneider's criteria. Schneider's first rank symptoms is what you have to remember. अच्छा भैया, पागलपन कितने टाइप्स होता है? Schizophrenia, how many types? 1-2 points about each of them. Catatonic, अगर रीडिंग रूम में ऐसे बैठ गए तो ऐसा ही बैठ गया, ऐसा ही बैठ गया, कुछ भी नहीं मूव हो रहे, अरे भाई catatonic. But there is best prognosis. Obviously, if you can sit like a waxy flexibility of a catatonic guy, you are definitely going to get seat, है ना? That is the reason best prognosis. It is late onset. Obviously, फर्स्ट ईयर, सेकेंड ईयर, थर्ड ईयर, फाइनल ईयर में पढ़ते क्या? हम नहीं पढ़ते जी. एंट्रेंस बोले तो पढ़ते हैं. इसलिए लेट ऑनसेट इंटर्नशिप में शुरू होता है. क्या शुरू होता है? जाके रीडिंग रूम को वैक्सी फ्लेक्सिबिलिटी के साथ बैठ जाना. सो कैटाटोनिक बेस्ट प्रोग्नोसिस, लेट ऑनसेट. म्यूटिज्म, किसी से बात करते क्या रीडिंग रूम में? नो. रिजिडिटी, ओ नोबडी टच मी. वैक्सी फ्लेक्सिबिलिटी. नेगेटिविज्म, किसी कोई पूछे तो क्या बोलते हैं? कैसे पढ़ रहे भाई? क्या पढ़ रहे? कुछ भी नहीं. क्या है ये MCQs है, भूल जा रहा हूँ मैं, इधर पढ़ रहा हूँ वहां भूल जा रहा हूँ. तो वो नेगेटिविज्म. इकोलालिया, आपका रीडिंग रूम सुबह रीडिंग, आपके रूममेट सुबह उठ के क्या करेगा? इकोलालिया. मोस्ट रेडियोसेंसिटिव ट्यूमर, सेमिनोमा. सो दैट इज इकोलालिया. इकोप्रैक्सिया, मैनरिज्म, ग्रिवेसिंग, ऑटोमेटिक ओबीडियंस, एम्बिटेंस, ऑटोमेटिक ओबीडियंस. आपका नीट पीजी कोचिंग में टीचर दिस इज द मोस्ट कॉमन बोले तो हम भी मान लेते हैं वही मोस्ट कॉमन है बोल के. दिस इज द आंसर बोले तो हाँ सर दिस इज द आंसर. ऑटोमेटिक ओबीडियंस, catatonia, catatonic schizophrenia. Ambitendency, verbigeration is what you need to remember. There is an entity called lethal catatonia or pernicious catatonia, right? Now, paranoid, most common type of schizophrenia are the doubting Thomas. Paranoid. Amphetamine also can lead to similar symptoms like paranoid schizophrenia. That is what you need to remember. Simple schizophrenia has worst prognosis. Too much है ना? Simple है, worst है prognosis. Oh my God. So it is very difficult to be simple, doctor. Life में complex रहना बहुत easy है, simple रहना बहुत मुश्किल है. Most difficult diagnosis, simple, right? So why simple is having worst prognosis, doctor? Because अगर आप simple type of schizophrenia लिए तो it has got a lot of negative symptoms like avolition, apathy, anhedonia, reduced affect, lack of initiative, lack of motivation, low activity, absence of hallucinations or delusions or any kind. So diagnosis भी मुश्किल है. लेट हो जाता है diagnosis. क्यों ये ऐसा है? Why this fellow is so apathetic? Why avolitional? Why anhedonia दिखा दे रहे? Why he has got such a poor mood? Why there is lack of motivation? Why this kolavaridi? By the time you make a diagnosis, it become delayed. इसलिए simple type of schizophrenia जो होता है भाइयों, worst prognosis, most difficult diagnosis. Now, doctor, FROP, F-R-O-P-F, froth. Schizophrenia in a patient who has mental retardation already, इसको बोलते हैं froth, right? So froth ये नाम क्या है मैं P-F-R-O-P-F, froth. अच्छा, froth बोले तो typically it is discovered by a German psychiatrist called Emil Kraepelin in 1919. अभी हम कहाँ हैं? 2019. Oh my God, 100 years के पहले they discovered this. Too good now? Now, Frofen means to graft. So, Frofen literally grafted schizophrenia. That is, as if schizophrenia is grafted upon a pre-existing mental retardation, is called as froth type of schizophrenia. So, आप क्या याद रखना? Schizophrenia in the presence of mental retardation क्या होता बोल के एग्जामिनर पूछेगा. आप क्या बोलना? प्रोफेसर होता है, सॉरी फ्रॉफ होता है, सॉरी प्रॉफ होता है, फ्रॉफ होता है, राइट? हाँ. नाउ हेबिफ्रेनिक schizophrenia. हाँ, teenage, the sweet teenage. It is a very early onset. Teenage में आता है हेबिफ्रेनिक. Hebephrenic in Greek means teenage, right? Now, it has got a bad prognosis because early onset जो होता है schizophrenia, it will have a bad prognosis. There will be senseless giggling, mirror gazing will be done by the hebephrenic schizophrenia. Finally, you have undifferentiated. बढ़िया, हम कितना पढ़ाई किया देखा ना last 15-20 minutes में. This is how खेलते खेलते पढ़ाई करना है. 600 hours of your time invest with Dr. Murali Bharadwaj. Once more, a small commercial. 953 high yield topic, 600 hours video discussion ready made available है आपके लिए online mbbs.com वीडियो लाइब्रेरी में. भाइयों, आप 9000868356 को कॉल करना, व्हाट्सएप स्टडी ग्रुप में ज्वाइन होना और हमारा ऑनलाइन mbbs.com का वीडियो लाइब्रेरी का सब्सक्रिप्शन लेना. फाइनली डॉक्टर, व्हाट आर द ड्रग्स इन mania, depressive psychosis? Lithium is great because it is a drug of choice for the acute mania. It is also the drug of choice for prophylaxis of the MDP. बाइपोलर होता है, बाइपोलर डिसऑर्डर. एक मिनट happy, एक मिनट sad. So prophylaxis also you can use, acute also you can use. Valproate, if there is a rapid cycling, 11 o'clock को मैं हंस रहा हूँ, 12 बजे को मैं रो रहा हूँ, फिर आफ्टरनून 1 o'clock को मैं फिर हंस रहा हूँ. Not because I am a NEET PG aspirant, because I am a rapid cycler. Rapid cyclers को इस्तेमाल करो Valproate. Carbamazepine, it is the second line drug for the rapid cyclers, typically used in the patients who are refractory to both lithium and Valproate. And sometimes hypothyroidism can be a predisposing factor. You always have to keep in mind when someone is depressed or maniac. So doctor, that is the story for the today's morning breakfast. 2 बजे को, 1 o'clock को हम सब मिलेंगे और मॉक टेस्ट का डिस्कशन करेंगे. प्लीज गेट लॉग्ड इन. एंड इवनिंग को मैं और एक डिनर वीडियो भी आपके लिए रिलीज करता हूं. पूरा दिन हम सब मिलेंगे, पढ़ाई करेंगे, इसी मूड में रहेंगे. नेक्स्ट 4 months को we will make the best use of the 4 months. This is Dr. Murali Bharadwaj, your YouTube mate, WhatsApp mate, classmate, reading room mate. Bye-bye. Read and enjoy the NEET PG preparation.